Good evening, friends. How are you this evening? I'm Peter Mathews on Fighting for Economic and Social Justice, our weekly program live streaming on YouTube. And we're going to focus today on the healthcare issue because it was a very important day today, and the U.S. House voted to repeal and replace Obamacare. That was something that President Trump or candidate Trump campaigned on. And so they tried furiously to get this through, but they didn't succeed the first time a couple of months ago. And they had to hold off on the vote. They didn't have enough votes, but today apparently they had enough votes to make some significant changes in Obamacare, actually repealing parts of it. We'll talk a bit about that during our discussion and our town hall with people calling in. But we're also going to focus on AB 562 in California, which is going the opposite way. I mean, while the federal government under Trump is going in the direction of limiting the public access to health care by making it more private and hoping the private sector can pick it up, the state of California says no such thing. We're going to go with the tried and true way of bringing health care to all, as the other countries have done. For example, Canada. A single-payer Medicare for all system is what AB 562 provides for California once it's passed and implemented into law. It is also similar to our Medicare that we have here for the elderly. And so if it works for the elderly quite well, it certainly works for Canadians quite well, because they're not coming here to get health care coverage. Many Americans are going to Canada to pick up at least less expensive drug having less expensive drug prices. They're picking up prescription drug benefits in Canada across the border, because the Canadian system of single-payer health insurance actually can bargain, and does bargain, with the huge insurance companies, drug companies rather, with the huge drug companies to lower the price of drugs. So there are many advantages to a single-payer system, which we'll be talking about. But let's start off for a few minutes before we open up the lines at 8:15. That's about 12 minutes from now. Before we open the lines up to the public, let's talk a bit about the philosophy behind universal health care. I think it begins with the assumption that many of us on the progressive side of the spectrum have, that healthcare is a human right that should be guaranteed to all. It is connected to the right to life, even the right to liberty and pursuit of happiness, as our Declaration indicates is the guiding principles of our nation. A right to life, liberty, and pursuit of happiness are all connected to the right to healthcare. Universal, high-quality healthcare that is guaranteed to all. Not a health system or health access that can be attained by working individually and buying your insurance privately from private insurers and hoping that they'll give you the best service for the price you're paying, and hoping the competition will work to drive the prices down or keep them affordable. I have never seen a competitive free market healthcare system provide adequate healthcare coverage for everyone in the country. I've never seen that work anywhere. Almost all of the countries that I know of that have universal healthcare have some form of government regulation and or direct government involvement in the healthcare system, such as in Britain, where they have socialized medicine, where the government in the public system, which most people adhere to and use, the National Health Service as it's called, the government pays for the doctors, the nurses' salaries, the doctors' salaries, and the hospitals' costs, and even building hospitals and to train doctors. The government pays for all of it, and people get treated with no co-payments and no deductibles, and the price of drugs prescription drugs are very low because they're subsidized. So all of this is done, and extremely important. I think there's a phone call coming in. We have to ask them to call back or hold for a few minutes. Yes, hello, good evening. You reached Peter Mathews, standing up for economic and social justice. Who's calling, please? Yes, Yosh. I was wondering, let me see, we're almost done. If you could hold on for 1 second as I conclude the introduction, we'll bring you right in about three or four minutes, Yosh. Could you hold on for just a minute? Sure thing. Okay, very good. That was a gentleman named Yosh Yamanaka. He'll be holding for a minute till we conclude the introduction to this segment, and then we'll have Yosh give us his comments and fill us in on SB 562. Well, California is going with a bill that's just passed the Senate Health Committee in California by a 5-2 vote margin, which is very encouraging, to bring about a single-payer universal healthcare system in California, such as in Canada, for example, and it would be funded by taxpayer money and by other sources coming in premiums coming in from the federal government as well. And that money will be then paid directly to doctors and nurses to cover the patient's care in a standardized system of coverage, which works quite well in those countries I just mentioned. So we will be moving toward that system hopefully in Canada, in California. I just keep saying Canada. They both start with a C, a CA, and maybe that's something that's quite interesting, that there's similarity there. Hopefully we'll have the same type of healthcare system here that will be very efficient, because in Canada, everyone is covered who's in the healthcare Medicare for all system, and they have no co-payments, no deductibles, and the provincial governments administer them very efficiently with only about a 3 or 4% overhead cost, as our Medicare also here does very efficiently administer Medicare in America, United States, for about 3 to 4% overhead costs, whereas the private systems of healthcare in the U.S. have cost around 22% overhead cost, which includes profits, and it's a very system that's very inadequate, and even Obamacare did not fix that fully, although we would like to take the Obamacare and fix it properly across the United States. In California, we're not waiting. We're going to go for a single-payer, universal healthcare system that will cover everyone, and per person cost will be 1/2 of what it costs today under Obamacare and under the private system. So that'll also be cost efficiency. The people in Canada live longer, about 3 or 4 years longer than Americans on the average, because of the single-payer system. So rather than me going on and on, let's hear from Yosh and his activity and his knowledge about an understanding of the single-payer proposal in SB 562. Okay, let's hear from Yoshi. Are you still on the line, sir, Mr. Yoshi Yamanaka?
Yes, I'm here. Thank you. Yes, I wanted to urge everyone to support Senate Bill 562, which is the Healthy California Act. And if you've been following the news on SB 562, it did pass out of the Senate Health Committee last week for the Senate Appropriations Committee. And I would urge everyone to call your state senators and have them support a Healthy California Act.
Okay. Very good. That is the good thing to do if you believe in this cause, which is a righteous cause, and will certainly make our system more efficient, Yosh. Wouldn't you say so?
Oh, absolutely. And for those of you who are following what transpired in Congress today, you will note that three Republicans in Orange County supported the AHCA, which is the American Health Care Act, just passed the House today. That would be Darrell Issa, Dana Rohrabacher, and Ed Royce. And they basically sold middle-class families down the river and are giving out handouts to millionaires and billionaires. So
right.
Those people who are in Orange County, you might want to think twice about supporting these three Republican congresspeople.
Yes, because the so-called American Health Care Act, the AHCA, which is really Trumpcare now because he's got his name on it, is an act that privatizes the system even further than the Obamacare system. It eliminates the requirement that people all get health coverage, and it doesn't really guarantee very efficiently the right to have health care without with a pre-existing condition. On paper it does, but it doesn't really limit the amount of money that the provider could charge. There are a lot of inadequacies and holes in this so-called American Health Care Act, which is a privatization mechanism. It's going to be a privatizing system of what little public interest there is in the Obamacare, which is an important first step in the right direction. These guys, including those three congressmen that he mentioned, have turned the clock backwards, and they're moving back to the old ages, which is really going to leave a lot of people. It's going to leave about 24 million Americans uncovered, as the Congressional Budget Office indicated in the first version of it. 24 million Americans who will lose their health care who have it right now. It also doesn't require that states expand Medicaid. It allows them to actually cut back on that. And this is a very bad retrograde bill, and I think that's why I'm so proud and happy that Yosh and other people are supporting, including myself. I am supporting the SB 562 in California 100%, and we need to have an SB 562 at the federal level. Take that nationwide once it works so well in California, or we should do it right away. So let's work forward on that. Look forward to that, Yosh, and we'll continue struggling and working and fighting for that.
All right. Please call your state senators and urge them to support SB 562.
Yes, call your state senators and your state assembly person, because that's where it'll go next, to be passed through the assembly once it passes the Senate, and then the governor would have to sign it. So we have to have the support of the state assembly members in your district as well throughout California.
Eventually.
Very
Absolutely.
Anything else you'd like to add, Yosh, about healthcare or anything else?
Well, I would urge people to get involved with their local progressive groups. I'm a member of Our Revolution Long Beach, and we're on Facebook. If you're in Orange County, I would urge you to get in touch with Progressive Democrats of America, the Orange County chapter, and get involved and make your opinion heard as far as healthcare for all of us.
Absolutely, and getting involved is the only way that we can get these leaders to do the right thing. I love Mahatma Gandhi's phrase. He said, when the people lead, the leaders will follow. When the people lead, the leaders will follow. Am I right there, Yosh? That makes any sense?
Yes, absolutely.
And that's what
our
Yosh,
revolution is all about.
That's what our revolution is all about. I'm a member of it also, the Long Beach chapter of it, and we certainly have various groups, our revolution groups across California, across the United States, that are seeking to implement progressive issue and policies in government at all levels, including single-payer health care. So that's why Yosh is urging you to get in touch with that group, Our Revolution, locally with you wherever you're at, and in touch with Progressive Democrats of America, which is a progressive wing of the Democratic Party in Orange County and throughout California, actually, and throughout the United States. So there are people such as Yosh Yamanaka and other people who are very progressive in these policies, who believe in social justice and fairness and equality, and equality, not inequality, equality and fairness. And that's why we should really put our money where our mouth is and put our actions where our mouth is more than anything else. That's why he's urging you to join these groups and find the progressive group in your neighborhood, folks. Thank you so much, Yosh. Really appreciate that.
Sure. Thank you.
Very good. We'll wait for the next call coming in. Go ahead. Thank you so much. Okay, folks, so we'll continue the conversation for a few minutes here, and then I'm sure we'll be getting another call. Anyone else would like to call in? The number is area code 562-234-3319. Please dial 562-234-3319, and you will be put on the line live on Peter Mathews' show, Standing Up for Economic, Social, and Environmental Justice, at 8 o'clock Thursday evenings from 8 o'clock to 9 o'clock. And we open up the phone lines about 8:15, and we go all the way through 9 o'clock with conversations from the audience, as long as it can keep coming in. So whoever's out there wants to talk about this issue, specifically of healthcare coverage for all, and how to bring it about, and why we should have it, or maybe some of you are from other countries who have it already, and you know how it works when you live there, you could do that. Call in any time. While we're waiting for you, I'd like to say a few more things about the issue of healthcare. The right to life, liberty, and the pursuit of happiness. That is the seminal part of our Declaration of Independence. Why we broke away from Great Britain and established a nation that would put the people at the forefront. We, the people of the United States, we, the people, established the Constitution in order to secure the blessings of liberty for ourselves and our posterity, in order to promote the general welfare. All those things that are so important. In the Declaration of Independence, it talks about guaranteeing natural rights that come from the Creator. We're all endowed with the natural rights, the rights of life, liberty, and pursuit of happiness. Now, healthcare is so centrally connected to those natural rights. Without a guaranteed healthcare coverage and treatment when you are sick or ill, or even to keep yourself well through preventive medicine, we will not have a very successful life, physically speaking. We'll get ill before our time and perish. We will not have an effective method of pursuing happiness or the fulfillment that is our God-given potential to pursue whether or not you have the talent to become a doctor, a dentist, a nurse practitioner, a nurse, or a mechanic, auto mechanic, a computer programmer, whatever the talents are that you have. I said talents, plural, because each of us has more than one talent. Whatever we can pursue through education and through our talent development, the pursuit of happiness, giving us a fulfilling mission and sense in life, we cannot do it without a good, solid health in our lives. Our own health, it should be very sustained with good healthcare coverage, because if we have poor health, it's very difficult to do other things in life. So that's why healthcare is such a seminal part of the basic fundamental natural rights to life, liberty, and pursuit of happiness. That's why all the civilized nations, all the Western industrialized nations, the advanced democracies, including Japan, and many other countries in the global south, including Cuba, and other countries in the so-called third world, they all have universal health care in one form or the other. In Germany, it's an employer-mandated system, much like ours. Most of Americans, about 51%, get our health care from our employer, health coverage. They pay for the insurance through a private insurer with profit-making allowed. But our system does not have a good cost containment provision. Whereas in Germany, there are very strict cost containment guidelines put on insurance companies that sell insurance to the employer who buys it for their employee by law. And the government pays and buys the insurance from private insurer if the person's unemployed. So everyone in Germany is covered through health insurance in that sense. There are many, many other countries. Canada with a single-payer system of healthcare, which we call Medicare over there. They call it Medicare. Excuse me, could you hold on for just 1 minute, caller? I'm just about wrapping up this thing about Canadian healthcare. And in Britain, as I said earlier, a socialized medicine system where the government basically pays for the whole thing through taxpayers. The taxpayers pay for it through the government, I should say. So there are many different variations of universal healthcare. And ours is not universal. Even Obamacare was not universal. It still left 20 million Americans uncovered. So we have to improve on that and come up with a comprehensive healthcare system, especially the single-payer SB 562 that's in California's legislature right now, waiting to be passed through and then signed by the governor, hopefully, if the people will wake up and make phone calls. So let me hear from this caller. Who's calling, please? You've got Peter Mathews standing up for economic and social and environmental justice.
Yes, this is Brett Covey.
Once again, please, that was a little low. Go right ahead. I've just turned back the speaker. Identify yourself, please.
My name is Brett Covey. I'm from Long Beach, California.
Hello, Brett. How are you?
We share the same city. So I'm just fine. And so I'm just, I guess, learning that this bill just passed today in the Senate? Is it law now?
Which we're talking about two different bills here. One is the American Health Care Act. It's called Trumpcare now. We gave it a name, Trumpcare. That is the attempt to repeal and replace Obamacare with Trumpcare. That bill passed the House of Representatives today. The other bill that we're talking about is SB 562 in the California State Senate, which just passed the State Senate Health Committee in California. It's on its way toward going through and becoming a law, hopefully. Universal single-payer healthcare at California level.
Yeah, from what I'm just learning from the internet, I suppose, is that probably good that California is coming up with a bill. I want to make a comment. I'm seeing some Twitter comments from some important people. Bette Midler, of course, I love Bette Midler.
Yes.
Can I quote her?
Absolutely. One of our favorite singers and entertainers, Bette Midler, yes.
She said, GOP passed a health care bill. It's so bad that they exempted themselves from it.
That's true. I heard that too.
They may live longer, but when they die, it's straight to hell.
Whoa, there goes Bette. That sounds just like Bette Midler. The GOP passed the health care bill that was so bad they exempted themselves from it, she said, huh? Oh, my goodness.
So now I got to know how bad it is. It sounds like a Jay Leno joke,
yes.
Or Johnny Carson.
Yes, indeed.
It's so bad.
Yes.
How bad is it?
Oh, my goodness. That's amazing. Brett, I've got another person on the line, Julian Berger. Do you want to hold on a minute, or would you like to call back in about 5 minutes after I talk to Julian? And we'll continue.
I'd like to hear what Julian has to say. I know Julian. So,
yes, absolutely. Okay, very good.
Okay.
Let me call back in about 5 minutes. As you're listening to the show, you could hear Julian, okay?
Sure, great.
Okay, thank you. Oh, you know what? Hang on a second here. Looks like... Brett, go ahead. And don't go. Julian will have to call back. I think he got cut off. So go ahead and continue, Brett. You were giving us Bette Midler's comment about that. Go ahead.
Yeah. So that's really interesting. How could they come up with a healthcare bill that's so bad that they've exempted themselves from it? They probably have a private health insurance that doesn't have anything to do with Obamacare. Does this affect the private insurers?
The system that the Congress members have, I believe, is they have options to choose whatever health insurance company they want, and the government pays. The government, as part of their government contract, as government employees, they get it paid for by the government, the taxpayer. You and I are paying their health care insurance premium, and they get to choose which company they want, which is on the best plans. Which one offers them the best plan? Whichever private company, they choose it, and they get it full coverage. So that's not what the American people are getting, is it?
No, and it's scary to me because I'm on Medicare.
Yes.
So I'm just wondering how this is going to affect me. It's already, something's happened because my doctor has told me that they're losing their office. We're going to have to move to an office in Whittier.
Oh my God, where is the office now? Tell me where your office was and how far the move is.
Yeah, well, I'm in Long Beach, so Whittier is about 15 miles from here.
That's too far away. Look at that.
Yeah, and I mean, if I want to keep the same doctor, and I do, the next doctor I can see, I believe, is in Paramount.
Mm-hmm.
Oh, wow. And then Downey. So we don't have any good doctors around here. They're not. I don't see it. Well, I do see a doctor. He's a therapist. Mm-hmm. So, and the person that acts like the doctor is a nurse practitioner. That's what we all have now. We have nurse practitioners. Mm-hmm. We don't get to see our doctors anymore. A nurse practitioner comes in and pretends to be a doctor, and they prescribe the pills and make the decisions a doctor used to make. Mm-hmm.
So what is happening to the quality of American healthcare? I mean, what is going on? Other countries don't do that. Other advanced countries.
No.
And what do you think is the cause of that, Brett? What's caused our system to degenerate like this, and to not ever be a proper healthcare system to begin with, a fully covered system?
Well, I'd say money has to do something with it, and I would suggest that it's probably the HMOs lobbying our Congress to put in things that favor their making the money. And I mean, that's what I would think.
So the insurance lobby is very active in Congress. Are you suggesting the health insurers?
As far as I know, I think they're very active. I know the pharmaceutical companies definitely are.
So a lot of these healthcare industry actors, such as the pharmaceutical companies, the health insurance companies, the HMOs, even for a while the American Medical Association, these medical device providers, these are all health insurance industry. They make money. They're profit-making entities, right? Mostly.
Right. In fact.
And they have money. They make a lot of money. They use part of that money to lobby members of Congress. Is that what you said?
Yeah.
In favor of their positions, the private system.
Right.
Of for-profit healthcare.
And I don't know when they came up with it, but somewhere along the line, they changed what they teach in ethics about business ethics.
Let's talk
about that. And now business ethics doesn't have much to do with the customer anymore. It's all about making profit, because they actually what they're telling people is that I think it's a law. By law, the corporation has to do everything it can to make as much money as possible for the stockholders, and so they're actually complying with the law now to screw the American public. Now that's going too far. I mean, that
sounds to me
ridiculous, but it is the truth.
Well, then it seems to me like that kind of law has to, or a rule or policy has to be changed, because it's just counterproductive to make healthcare a commodity, a material good that is not connected to spirituality or connected to something as sacred as health. It's a material product the way it is right now. They're buying and selling your health. And if it's not profitable, if the medical insurance company has to pay too much out to keep you alive, then they allow you to go down. They just say, let them die eventually. They're going to die anyway. We won't give them full treatment. We don't have to.
Yeah.
It doesn't make us profit. So that to me is an ethical question you're raising. Looks like another call's coming in, Brett. Hang on 1 second.
Okay, either you or me.
Doug Kurtz. Let me merge with you. I'll put you on with him. Okay. Looks to someone named Doug. Hello, is this Doug Kurtz? Hello?
Hello, Peter.
Hello, Douglas. How are you, my friend? You're on the line with Brett Covey, and you're on the show Standing Up for Economic, Social, and Environmental Justice by Peter Mathews. How you doing, buddy?
Awesome. Very good, man. Fantastic.
Right. Good to hear from you, man. Doug's an old friend of ours. Brett Covey's on the line also?
Yes, I am. I'm right there. Hey, Brett. All right.
And we're talking about healthcare, Doug. We're talking about healthcare specifically. The lack thereof for over 20 million Americans are still uncovered with healthcare, even with the Affordable Care Act.
Yeah, that's we're in the Stone Age as a country as far as taking care of the people in that respect. I mean, it's really sad.
Yeah, and do you know that today the U.S. House of Representatives voted to repeal and replace Obamacare and make it even worse by privatizing it further?
And not being able to treat people with pre-existing conditions.
Oh yes, there's no guarantees now with that as well. They're saying there is, but it's really, they're not providing the kind of funding that would be needed to cover everyone who has pre-existing conditions. It's all big talk. And they're also leaving out a lot of other aspects. They abolished the Obamacare aspect where people have to buy insurance. I think the best system would be one in which we all paid proportionate to our income into a type of a revenue sharing mechanism, like a tax, if you want to call it, a health tax, progressive, where the upper incomes get to pay a little bit more than the lower income people. And we'd all pay in whatever we can afford to. And that money would be taken and then it would be paid out whenever people get sick. It would be paid directly to the doctors and the nurses and the hospitals to cover our sickness. And the government would administer it. It would only be a 3% overhead cost to administer that. That's how it works in Canada.
Yeah, that's how it works in part of Scandinavia too.
Yeah.
You know, there's a lot of good examples that we could learn from, and you know, if the people aren't healthy and they aren't, if they don't feel like they're taking care of, the morality and the production and the efficiency of the workforce and the social climate will decline.
Absolutely.
And, you know.
And Doug, you know, one more. You mentioned the workforce. That's interesting because it costs almost $2,000 more to build the same car in the United States as in Canada, because Canada has that single-payer Medicare for all system, which takes the burden off the businessman and women. It takes the burden for covering their employees off the back of the businessman and women. So it costs almost $2,000 less to make a car in Canada. It's the very same car that it costs $2,000 more per car to produce it in the United States, and that makes us less competitive business-wise as well.
Absolutely, and it's and a lot of people aren't aware of that, you know, and they're not putting that out there for people to see. So, you know, people could. Some of the politicians really need to bring that to the forefront.
Yes, exactly. All these aspects of it. So, Doug, what about yourself? How are you doing with healthcare coverage?
Well, you know, it's funny you ask. You know, I have been shopping. Oh, and I did send you some.
Yes, I got the phone numbers. Thank you.
Okay. Yeah. Well, I'm thinking that I'm going to go with a low-cost private company and just do that. Medi-Cal is pretty good. I hope it lasts.
Yeah. By the way, this reform that was passed in the House today by the mostly right-wing Republicans is going to reduce the Medi-Cal coverage for millions of people. It's going to let states cut off Medi-Cal coverage or limit it. That's not good at all. But go ahead, continue. I'm sorry, you were talking about yourself.
It's very vital that we provide, you know, health care for especially for the lower income people, because if we don't, they won't be able to go to school, get back to work, and become productive members of society. You know, you know, and I'm not saying that they aren't productive members of society. Yet, you know, when people are not taken care of health-wise, we can't build a strong educational system, a workforce, and so it's a very important thing. I was watching the news earlier today, and I saw so many people that were upset at what was going on, why they were, you know, taking Obamacare off. Obamacare really helped a lot of people.
Yes. There's a big news item today, what the U.S. House voted on and how they voted. Yes, go. So, Brett, what do you think of that? All this?
Well, I think it's terrible, and I have a friend that's in the hospital right now because of bad teeth, and his family is weighing: do we fix his teeth or do we buy a coffin for him?
Oh my!
They literally have to make that decision.
Oh, that's horrible. That is so horrible. And speaking of teeth, Brett, you know, many of us know that the digestion begins in the mouth, and teeth are very, very much connected to health. And yet, the United States does not have a comprehensive dental system. Even when we have some kind of health care coverage for employees, we don't require that the employer provide the dental care. Whereas the other countries that have the universal health care include dental care in the system, in the plan. And that's what SB 562 includes dental care as well. We were talking earlier, Doug, I'm not sure if you heard the conversation about the Senate bill in California Senate that would give us a single-payer universal system if it passes. It just passed the Senate Health Committee, and it includes dental care, by the way, universal dental care as well. Yeah, so I'm glad that Brett raised the issue of teeth and dental, and I'm very sorry to hear that about your friend. It's just tragic that this could happen.
Yeah, Brett.
I hope it doesn't. I hope it doesn't go any further than that. Really, I mean, doctors have a responsibility to keep the patients healthy, not set them up to die. But he's in the hospital right now because of his teeth are going septic.
His teeth are going septic from a tooth infection, Brett, that couldn't get treated, or what?
Tooth infection, and they're trying to get him down right now with antibiotics.
Mm-hmm.
It's a hospital cannot legally let him go until they have him fixed up. But see, it never should have gotten that far.
Never should have gotten that far. That's the key.
You have to in order to get medical care in this country, you have to get so sick that you have to be taken by ambulance into a hospital.
Right. You have to
go to the edge of death.
Yeah. Not only
you have to go to the ER.
Oh my! Yeah. It's so tragic, and it's so immoral, unethical, but it's also impractical and uneconomical, because you save money when you address these issues earlier as preventive care, as continuing nurturing of the human and body and physical spirit and body. If you have a health system that does that, you don't let it go this far, and it doesn't cost as much. Am I right?
That's right.
Yeah.
It's right, and it's it could be fixed. That is the good thing. The whole system could be fixed, and I think people, because of what's happening, are coming up with the plans like what we're talking about, and so it's one of those things where it takes something like this to bring out something. I mean, that's what happened with Obamacare. He had to come up with something because we were in a bind. And
yes, indeed. Matter of fact, yes, go right ahead. Go ahead.
It was a good thing. One of the things that I see is in the medical field, and it's really sad, is that on just about the doctors, the physicians, for so long, would have to take a Hippocratic oath, which means that they're sworn to help their patients and have them in their best interest, and and they take this oath. Well, that's been removed for years now, and it just and what's the purpose of that? But it's a sign of the times, that the patients and the general public, they're being overlooked in a very important section of life, and so.
Yeah. By the way, I was going to back up what you just said. I was going to tell you a couple of statistics that before Obamacare was brought in 2010, 2011, the healthcare inflation rate was going up by 12% per year. The cost of healthcare were increasing by 12% per year. Once Obamacare was brought in, the first few years of it, it went down to 5% per year, the rate of inflation. But now it's back up again to about 8 or 10% inflation per year. So there's a real problem with the system as it is, and it has to be worked on in a cost containment manner that would give patients complete choice of doctor, and would give the doctor and nurse complete freedom to treat the patient without the bureaucrats such as insurance agents, insurance managers coming in, HMO managers telling you, the doctor, don't give them that diagnosis treatment, it's too expensive, try the less expensive one. So this kind of thing is an interference in the actual Hippocratic Oath. The Hippocratic Oath is brought up, isn't it?
Yeah.
That's what's been going on in our system, not in the system in Canada or in Britain. Over there, they get treated according to what the patient needs, not what the corporation wants to make in profits.
Right. It's we're financially bound to accept whatever care they want to give us instead of the looking at what the patient needs, like you say, and then being able to choose the doctor if you don't feel like you're getting the right treatment. You know, you have the freedom to go to somebody else, and that's a very important thing that so many people in times past, from what I know, people would really seek out the physician that they found, worked with them.
Right.
And when they found them, they would keep them as long as they could. So we need to kind of get back to that ability to have also the trust, the quality of life when we're not able to count on healthcare and stuff. It creates a type of fear psychologically in the public, and it's
Doug, I just wanted you could hold for 1 second. I'm going to call a number that was calling in a little while ago. We didn't get him on the line. Someone named Julian Berger. Let's see if we can. Are you still on, Doug? Okay, looks like we're redialing Julian Berger, who was a caller earlier who we didn't get a hold of. Let's see if we can get him on the line, folks, here to give us his views on healthcare and coverage.
Hi, this is Julian. I'm not available right now. Please leave your name and number, and I'll
cell
get back
phone,
to you
the
as
answering
soon as
machine,
possible. Have a nice day.
the voicemail.
After you leave a message, you can modify it by pressing pound.
Hello, Julian. Calling you back. You called in on the show, and I want to merge you with Brett and Doug on the other line. Doug and Brett, are you still there?
Well, you've got me.
Okay.
And I do have more to say.
Okay, yes, please go ahead.
It's actually information.
Okay.
Which I'm getting now from the New York Times.
Excellent.
The winners and the losers. And this is where I think this really could be unconstitutional. Maybe this bill could be thrown out in some manner, but it seems that the upper class people without pre-existing health conditions are the biggest winners of this whole thing.
Okay, there comes Julian Berger. Hang on, don't go away. Hello, Julian Berger calling?
Yeah, hi.
Yes, Julian Berger. Hang on 1 second. Make sure that Brett Covey's on the line as well on conference call here
I am
the show.
on the line.
Okay, very good. Julian, Brett was telling us about the New York Times report on this new vote on the healthcare, the American Healthcare Act, Trumpcare that was going on. Let Brett finish that real quick, and we'll come right to you, Julian. Go right ahead, and you can just listen up on. Go ahead and tell Julian on the audience what you were talking about, Brett.
I'm going to read this and see if I can understand it. I'm just finding it. But they have divided the middle class from the upper class from the poor. The upper class people without pre-existing health conditions. The Affordable Care Act cut off subsidies to help people buy their insurance at an income of around $48,000 for a single person. The American Health Care Act would let people get government subsidies much higher up the income scale at about $150,000. The bill allows states to waive those rules, blah, blah, blah. That means overall...
Your message has reached the maximum duration allowed. To re-record, press 1. To listen again, press 2. To cancel your message, press 4. To confirm, press pound.
Okay, are they still there, John?
To re-record, press 1. To listen again, press 2. To cancel your message, press 4. To confirm,
I think we're on.
press pound.
Somebody's got to press a button here.
To re-record, press 1. To listen again, press 2. To cancel your message, press 4. To confirm,
That's
press pound.
Mine?
difference between a human being and a computer.
Well, yeah, the computer.
Okay, hopefully she's gone away. Hopefully she's gone away.
Yeah. She doesn't make any good points anyway.
Yeah, go ahead and continue, and then we'll hear from Julian.
So, overall, the gap between tax subsidies and the cost of the need for care widens. Young and middle class people, this is something. If they brought back this pre-existing condition thing, but they left in they can't cancel your insurance if you have a pre-existing condition.
Right. They left that in there, right?
Yeah. Okay. But you can pay a higher price to get it.
Right. Which could be a lot higher price. A lot higher price.
The other thing is, if you can't afford it, well, you can opt out entirely.
Yeah. And not get fined.
You'll
You'll be opt out.
Mandate,
yeah.
And you can just opt out and not get any care whatsoever.
Yes.
But I guess there's if you can afford it and don't obtain it, you'll have to pay a penalty.
Are you sure? Is there that penalty, that individual penalty still there?
That's what New York Times is saying. Bill eliminates an individual mandate, but charges a tax penalty to Americans who can afford insurance but do not obtain it.
And who decides who can afford it and who can't afford it? Who decides that?
It goes by income.
Okay. There's an income level, okay. Okay, go right ahead, Julie. Anything else, Brett, before we go to Julian? Go right ahead and finish up. Go tell us what you're saying, Brett. Continue.
I would say, it always, they don't talk about it too much here, but I would say the biggest losers, of course, are the poor who can't afford any services at all. Or maybe if you've done it, I've done it before I had Medicare. I'm on disability right now. To have to go and get medical care and go into an emergency room to a public hospital and wait in line for between 8 to 12, maybe 16 hours.
Wow. Yes.
In the emergency room.
In the emergency room.
Right.
8 to 12 to 15 hours.
Throwing up, and in fact, I got a really bad cold, a terrible cold for being in there. And people are throwing up. One lady was having, I guess she was having an abortion right there in the room. Nobody helping her. Wow. And she was cold, and I ran out to the car and came in and gave her my coat. And so she could stay warm. And then I just got the hell out of it. I figured my toothache pain, if she has to go through this, I just, actually, she cured me.
Oh my! So in other words, she was in such a bad shape and being treated so badly that you felt that you don't have many problems. But it's what a horrible way to have to look at this whole situation when you should have all been treated well, fully adequate healthcare system based on human need, and not corporate greed. Yes, exactly.
There's blood on the floor.
Oh my!
They wouldn't even send out a janitor to clean up the blood.
Horrendous. Terrible. Julian, let's hear from you.
Well, the thing is this. So basically, I'm curious. I haven't read the New York Times yet. I'm just getting like the LA Times, shots on because they send me the updates. The thing is this is that what about, there's two components to the Affordable Care Act. Okay, if you can't afford is coverage, the marketplace, then you could basically be put on Medi-Cal if you're in California or Medicaid nationwide. Now, granted, there were many states that wouldn't allow it. I mean, a lot of these southern governors, who have poor people up the kazoo, wouldn't allow these poor people to actually get on, Medicaid. Right. Okay, and everything like that. And so what's the deal with that? Because believe it or not, that actually, the cost of care through the Affordable Care Act was not that competitive. It was pretty expensive. I have friends I don't have it, but I have friends that were telling me, oh yeah, I'm spending $1,800 a month. And this woman's like, 55 years old.
$1,800? Wait a minute. Let me repeat that for the audience. Did you say $1,800 a month, Julian?
A month premiums.
Premiums. So outrageous.
For yourself alone.
Yes. For one person.
That's the best we can get. So these are the ACA is not the best deal. Actually, in my mind, the best deal was the fact that it expanded
Medicaid,
Medi-Cal,
and Medi-Cal,
and they lifted up the cap on it.
Yes.
So you could have a higher income. Like, for instance, I can qualify for Medicare.
Yes.
I have friends that can qualify for Medicare. And what it allows you to do is go to, like, the local neighborhood clinics, which got beefed up by this. And then that was one of the things, just they by basically allowing, monies to go into these small community clinics where people go.
Yes.
Where basically, because going to a big hospital is just a mind-blowing experience, but you go to your local clinic, you have a relationship with your doctor, and then most of the money is picked up.
Right.
Okay?
Right. And by the way, the government provided more funding. They provided more funding. The feds did.
And let me tell you something. Yeah. That is the closest thing that we have out of this thing to single-payer universal health care.
Yes. Yes.
But it's still for people on the lower end of the economic spectrum. Because if you get, I don't know what the split is, but when you make more money, then you're pushed into the people pay kind of thing, where you pay a lot of money. And then the whole idea is that, remember, this whole thing was set up by a relationship between the Obama administration and the healthcare industry, okay, to be able to get money out of the healthcare industry to basically Democrats. Now, the good thing about it is, like I said, is people at the lower end of the economic spectrum, until they raised it, are getting single-payer universal health care. But the people and we're not even talking about wealthy people, we're talking about middle-class Americans.
Right.
They're having to pay a very high premium. Like, I couldn't afford it.
Right. I mean, we're talking about $1,800 a month. That's so outrageous, so expensive. $100
a month. I was talking to this person, and granted, this person lived up in Rancho Palos Verdes, but this person wasn't part of the 1%.
Right, not at all, not even close.
No. And I said, "You're kidding me? That's for you?" He says, "Yeah."
Right.
I mean,
So to me, it seems you're saying there was an aspect of single payer for many people that were covered under Medi-Cal and Medicaid. That was there. That was being expanded and funded more fully by the Obamacare policies, and yet that's being taken away now by this Trumpcare introduction of Trumpcare that the House just started to do today.
But I'm assuming it does, because let me tell you something. It gets people in the mental mood for single-payer universal health care.
That's true.
I mean, that's the whole thing. If you have people who now are seeing what this is, if you can't afford medical care because it's too expensive, it's one thing. But if you qualify just by being alive, okay, but you're below a certain level like most people are, then basically, I bet 2 to 1 if you come along with single-payer universal health care, these people say, "Yeah, I want to do that." I already got it.
Well, we already know the polls show us 58% of Americans support a single-payer healthcare system like Medicare. They support it. 58% right now.
Right, exactly. I'm surprised it's not higher.
Yeah, that's true. Maybe they don't understand it fully.
And let me tell you something. If they repeal all of Obamacare and they take away that Medicaid, Medi-Cal, expansion, it'll be higher by the time the 2018 election comes along, because those people will have a taste of it.
Yes.
And they're going to be really unhappy.
By the way, there's another aspect we haven't touched upon.
You're not going to be able to afford the high-end stuff, and the stuff that was taking care of them, it wasn't Cadillac treatment, but it was covering them.
Right.
It's gone now.
So you're going to have a backlash in the election you're talking about, 2018, very possibly.
Yeah, that's what I think. And these people actually were people, a lot of people don't realize this, but the bottom line is the people who are going to get affected most adversely, by the repeal of the ACA and basically the Medi-Cal, Medicaid expansion, voted for Trump.
That's right. A lot of them did. Julie, I'd like to add, and Brett and whoever else is out there in the audience, there's one other aspect we've not talked about, pre-existing conditions. The Trumpcare, which was just passed by the House today, actually allows people to still be covered with pre-existing conditions, but there's no limit as to how much they have to pay. They got to pay out of their pocket and pay way too much money if they have a pre-existing condition on the new system that's proposed. One more thing, and the subsidies that were supposed to be coming in from the government to keep the pre-existing condition patients having affordable care, those subsidies are being cut by the new Trumpcare, as I call it.
Right.
That's going to hurt a lot of people in the special pools that cover the pre-existing condition folks. Their subsidies are being cut back, and there's no cost containment, and they're going to have to be paying a lot of money without the subsidies. So this is a very convoluted solution. We have to look at how it's going to come down in the Senate. That's going to the Senate next to be voted on.
Yeah, right. And the thing is, I don't know. I don't know if the Senate will be more detained in the fact that they're not going to go off on this stuff and vote for the House version.
Uh-huh.
Okay, or are they going to...
Hello? Someone's calling in there, gentlemen.
Hi, this is Tony Castro.
Oh, we've got another caller there. We've got 3 people on the line now. Go ahead. Tony, Julian Berger is talking about something. Hang on a bit, Tony. Let's hear what he has to say.
Sure.
Regarding healthcare.
What? Me? What?
Julian, go ahead.
I'm just saying is that states, or I mean population, the people actually want changes from election cycle to election cycle, but you're not talking about a congressional district which sometimes has a static political view on things, right?
Right.
States are a lot more flexible, so some of those people may not go along with it. Those Republicans.
Yeah, that's true. There may be a backlash in the polling, in the polls.
Well, I was for a re-election in 2018, and what they fail to realize, they didn't forget about the aspect of the ACA adjustment where you pay the bigger premiums and you get, a decent treatment. They forget about that Medicaid expansion where it gives people a taste of the single-payer universal health care, and they like it.
They like the taste. They're not going to like it taken away. They won't like it taken away from them. Julian, Tony, yeah, they're not going to like it. There could be very well a backlash against the Republicans who passed this American Health Care Act bill today. By the way, gentlemen, Tony Castro, I've talked to him earlier in the day. He has a story to tell you. That this is the tragic. This is a story. Go right ahead, Tony. Tell us your story, what you think about all this, and what with the example you're going to do.
I'm definitely not happy with the way things are going with the healthcare system and the direction that they're going in and the plans. The way currently things are really messed up. I mean, they're supposed to get worse. Is that possible? Wow.
Yes,
but
it is.
right now, for example, I have a friend named Lupita, and she has a newborn baby, infant, not even a year old yet. And her baby, beautiful, smart, intelligent baby, and has the potential to become anything she wants in life. This baby, it really truly could be anything she wants.
Yeah.
But she has one issue going on with her skull. The baby's skull was shaped to the left. It's pointing to the left, sticking out to the left a little too far. So she needed a helmet to kind of reshape the skull correctly.
Yes.
And before the baby's head, the skull hardens, it's still soft enough where they can do something about it. And she's been going back and forth to different hospitals, different doctors, and trying to get an approval for this helmet. Well, the months gone by. It's been like four months already. And
4 months.
A helmet. 4 months. The baby's head the skull is hardening. It's going to be too late. And they're fighting over who's going to pay for the helmet. She has a Medicare. She's under the government funded medical system. It's not funded enough, not full funded. They won't give her the helmet because they said it's cosmetic.
Cosmetic. Look at that nonsense.
Her head is cosmetic. So now this baby who has the full potential, beautiful baby, smart, real smart for such a young baby, and she's so smart. You can tell that the baby's smart, the way they respond and react, and just by the way that they act. And anyways, now if she doesn't get this helmet to reshape her skull, what can happen is now she can be made fun of in school, maybe in elementary school.
Yeah.
People can make jokes. You know how kids can be, how kids are.
Yes,
and,
of course. Very cruel sometimes.
And then she can get low self-esteem and might not reach her full potential because of
I want to let everybody be aware of what kind of system we go.
But Tony, can that also be a physical damage to her brain because the skull has not been reshaped properly? Could it have physical damage as well?
I'm not a doctor or a neurologist, but common sense, I mean, I would say
you would want to have it as normal as possible. You want to have the skull as normal as possible.
Your head and your brain is the most important. I mean, without your brain, without a kidney, you can still go on, but without your brain,
you mentioned the excuse that was given that it's a cosmetic procedure, which is the totally ridiculous thing. They're not looking at the full person and how this will affect the person's psyche, their mentality, their personality, having to walk around with a head shaped like that when it didn't have to be that way. Am I right?
Yeah, and yes, and
it's all about the money, about the profits for the insurance company or the HMO or the Medi-Cal system.
And so they can't. Medi-Cal denied it.
Is that Julian? Go ahead, Julian.
No, he was saying that actually it was Medi-Cal. Right? The one telling you it was a good thing. But unfortunately, many times the doctors and the hospitals denied it because the Medi-Cal wouldn't cover it because it was cosmetic. So the hospitals denied it. I mean, actually, there should be some way of basically getting it reviewed. You know what I mean? Because I'm sure that, I just can't believe that.
You're breaking up. You're breaking up, Julian. I'm not sure what's happening to your reception.
I can't believe that they can't basically change they have some sort of rules or something like that. Well, now I just came on the line, so with all fairness, if I could get a minute to speak myself.
Yes, certainly.
All due respect, I don't mean to interrupt you, but I wanted to get my chance in. And isn't it the job of the federal government to provide the people with its human rights? And one of those human rights is not only health care, right to health care, human right to health care, but to quality of life. And the government is failing right now. It's this child, my friend's child. The federal government is failing right now twice with this child. Not only to provide it with this human right, which is health care, but also for a quality of access to quality of life, which she might not have anymore because she might be made fun of or ridiculed, or kids make jokes and she can have that low self-esteem. So the issue is the federal level. We need to bring some of that federal funding and bring it directly to fund hospitals, hire doctors, build more infrastructure like hospitals, of course, and not just that, but medical research and advancement and progress.
And how about just expanding the funding for Medi-Cal so they could cover the helmet?
Increase the funding, you said?
For Medi-Cal. Put the federal dollars into Medi-Cal, not into the F-35 Joint Strike Fighter, which can't even fly properly. It's got a boondoggle airplane costing $200 million in the average per plane, which many generals said they didn't need. The defense budget is so bloated, Tony. Some of that money could be used for this young little baby through Medi-Cal.
Yeah.
Who's making these priorities?
I mean, we got money. We got billions of dollars to go preemptively strike. Isn't Trump, by his preemptive strikes, doesn't that make him an anarchist? Isn't he a right-wing radicalist, or doesn't that make him, he's no longer being he's being irrational there. But
what about all that money that was lost in the Iraq?
We got money to preemptive strike and drop bombs on places that didn't actually need to be bombed, and we got that extra cash. Well, we should maybe redirect that funding to healthcare somewhere where we can actually use it.
Well, for that, you've got to get the right people in Congress to tell the president, we're going to override your veto, or we're going to force you to pass this bill because we're going to vote for it. And if you don't go against it, we're going to override your veto and get the bill passed anyway to get the money from. Stop wasting money so much on military expenditures. Put it into people programs.
When you say get people to Congress, Peter, I want to mention something that vote does count. People say, I voted for the president, didn't count. Although, when you vote for the congressperson, that does count, and you vote for the congressperson that will vote for your president.
The congressperson can vote against the president or for their bill that they're putting forward.
For your president that you would vote for, and as your popular vote. And you want to make sure that your electoral vote goes the same direction as your popular vote. So a lot of people say, I don't want to vote. I voted for
Bernie or Hillary, and you know what happened? My vote doesn't count. Maybe the popular vote didn't count, but you know what? It does vote. The vote does count when it comes to Congress, and Congress is the one that's going to give the electoral vote. So.
No, that's not correct, Tony. Congress does not provide the electoral vote. In fact, the Electoral College is separate from Congress, but the numbers are based on how many members of Congress there are from your state and from your area. That's the numbers of the electors from each state is based on the number of members in both houses. But that's the elites who are appointed. Many of them are friends of congressmen, yes, the Electoral College. But you're right, the Congress's vote is so important because Congress has the power of the purse. Or the president can only ask for funding for health care or for the military or for weapons. And the Congress can redirect and redraw that budget and say, we want more money for that little baby in that hospital whose head needs to be helped than we need an extra 3 or 4 F-35 airplanes when we have hundreds of them already. That's what I'm talking about, why Congress vote is so important.
Yes. Yeah, and bottom line is we need to just register to vote. Everybody needs to just register to vote and I've said before, and you didn't agree with me, and I kind of didn't agree. I said, just vote, doesn't matter who you vote for. And you said, yeah, it kind of does. It does matter. But when I say that, what I really mean is more people are going to vote progressive in the end. Even if everybody did vote for whoever they wanted to, the majority is going to vote progressive.
Yes, and the polling shows that.
That's what.
You're right,
that's
Tony.
What works.
You're absolutely right. The polling of the American people, the results are far more progressive than the polling of just those who actually vote. So you're right about many who don't vote. If they voted normally, the way they would normally, and they were registered and they voted, it would be a more progressive vote overall in the country.
Yes. Yeah. So that's what I meant when I said just vote, just register to vote, because I knew there would be more numbers on the progressive side. And
we're running down a little short on time. Gentlemen, we have to kind of wrap it up a bit. It's a little after 9 o'clock already, but let's go ahead and each of you say a few words before we wrap it up, okay?
Thank you for having me. The last thing I want to say is I believe that the federal government should definitely fully fund healthcare directly 100%, and that way we can get rid of these issues that we're dealing with about these kids not getting full treatment. But just register to vote. Thank you for having me, and thank you for everything you're doing on the show.
Thank you so much, Tony, for being here. We'll have you back again. Definitely.
Thank you. All you guys too.
Is anyone else here on the line here still?
No, I'm
Oh, great. Both. Okay, let's go ahead and have some words from you.
All right. Well, I agree with Tony completely. That's just one of the worst stories I've ever heard.
Oh, it's so tragic.
Cosmetics? Are you kidding me? I mean, not likely. I mean, shoot, we treat people in third world countries. We send doctors to third world countries to help kids with cleft palate.
Yes.
Now, but we can't do anything for our own people that have some kind of malformation when they're born. No fault of their own, by the way. But even if it was, I would say that they have the right to health care, and it's certainly a human right. This is a civil right, and somebody's got to challenge this stuff.
Absolutely. That was you, I think, Brett?
Yeah.
All right. Thank you for the heartfelt words.
I'd like to call you again after the show, too.
Okay, sure.
There's another thing that's happening right now.
Okay, very good. We'll do that. Let's hear from Julian then, please.
What happens is I'm hoping that the Senate, does not go along with the House, because like I mentioned, you notice that senators, many senators sometimes actually have a long career, but sometimes senators can be in there for 6 years, and then people toss them out because states sometimes are rather fluid, in their political views, and I think these guys have these people have a lot of money to sit there and try to figure out how the voting public goes, and the last thing they want to do is throw away their career because they got a couple of people in the House, that think that they, run people's lives, against basically the Affordable Care Act.
Yes.
Not realize the full spectrum of like we're talking about. I think the most important part of that is the Medicaid, Medicare transit.
Yes.
Because it gives to people the taste of universal single-payer health care,
yes.
at a lower income level. You know what I mean?
True. That's true.
And I think it's great.
And really, I think the best way, we could just expand Medi-Cal, Medicare, and make it a single payer for everyone.
That's right.
There you go. That's the way to go.
We're just going to drop our income, that's all, to qualify. You know what I mean?
Mm-hmm.
And then, of course, that other gentleman, Tony, they've got to sit there and reevaluate what is considered, cosmetic and what is, mandatory surgery or whatever. I mean, that's completely crazy.
Yes.
And they have the money because the Affordable Care Act, one of the things is they pumped a lot of money into Medi-Cal, Medicaid. There's a lot more people that are covered from that. And that's why they were able to raise the income cap.
Yeah.
So, I mean, that's really unreasonable.
Absolutely correct. Well, thank you so much, Julian and Brett and Tony and anyone else who's out there. Please tune in again next Thursday evening, 8 p.m. to 9 p.m. and we'll have the introduction till 8:15. At 8:15 to 9, we'll have the call-in from the audience, okay? So tell your friends to call in next Thursday. Thank you so much.
Outstanding.
Okay, thank you. We'll talk again. I appreciate it. Okay, folks, I'd like to say good night to our audience, and I hope to see you next Thursday. It'll be a pleasure. And take care, stay safe, and keep struggling for social, economic, and environmental justice. Thank you.